It was one of those things where I woke up and I was like, wait, why do I feel so good? I had that pressure pain that had always been in my uterus, always. I had no pain. I had no discomfort. I felt like a completely different person.
Welcome to Curing with Sound, a podcast presented by the Focus Ultrasound Foundation. I'm your host, Allison Preston Smith. Adenomyosis is a painful and often misunderstood condition in which the lining of the uterus grows into the muscle wall of the uterus itself. It can cause debilitating symptoms like heavy bleeding, severe cramping, migraines, bloating, and fatigue, disrupting every aspect of daily life. For many women, the standard treatment has been hysterectomy, leaving few options for those who want to preserve their uterus and their fertility. In today's episode, we're speaking with Dr. Vanda Corbett, who has lived with adenomyosis symptoms most of her life. After years of worsening pain and limited treatment options, she traveled from Dubai to Chongqing Haifu Hospital in China to undergo focus ultrasound treatment. She's here to share her journey, what the treatment was like, and how it impacted her life. Welcome to the podcast, Vanda.
Thank you so much for having me. I'm excited to be here.
When did your adenomyosis symptoms start?
To be honest, probably I've had them most of the time that I've started menstruating. So probably around the time I was about 13, 14 years old. I've always had really, really severe periods and pain. And then about 6 years ago was when I was first diagnosed with it. And then just in the last year, the symptoms got really, really severe.
I'm sure it's been such a challenge experiencing all of those symptoms for decades now.
Yeah. So, the symptoms of adenomyosis usually have something like really heavy periods, like excessive bleeding when you have your menstrual cycle, and then also just extreme pain. So the whole muscle of the uterus goes into spasm, but adenomyosis is where the cells from the inside of the lining of the uterus goes into the muscle of the uterus.
In what ways did the symptoms disrupt your daily life?
Towards the last year, I would say I was having debilitating pain at least a third of the month. So about 8 days of the month, I would having absolutely 9 or a 10 out of 10 pain. So I would have the pain usually about maybe 4 or 5 days before my period started, and then 3 or 4 days during my cycle. So that was like the debilitating pain where I was in bed, out on painkillers, incapacitated essentially. And then the rest of the month in the last year, just like a constant nagging pain that was just continually there, but and just got progressively worse.
It takes women an average of 5 to 10 years to be diagnosed with adenomyosis. How long did it take for you to get a diagnosis?
Well, like I said, I originally was diagnosed about 6 years ago. And the thing is that I'm a healthcare practitioner, and I'm sure I had heard about this word once, maybe, just in passing in a class 20, 25 years ago. But I remember I was having an internal ultrasound, and the rad tech said to me, "Oh, you just have adenomyosis." And I just remember thinking to myself, being like, okay, it really must not be that big of a deal, right? It's just adenomyosis.
What treatment options did doctors initially suggest to you? Did they just diagnose you and then leave it at that? Or was there any course of treatment?
Yeah. So 6 years ago, I was just diagnosed with it. And of course, that was right around COVID. So getting actual healthcare was quite difficult. I do remember actually having the MRI with my mask on. So that's how I remember it was right around COVID. But then fast forward till just this past year, about this time last year, actually, is when I started to really have severe pain. And every single time I had my period, it would just be more and more severe. And so I had another MRI and an internal ultrasound. And at that point, they're like, well, you have adenomyosis. The only 2 treatment plans that we can offer you is opioid painkillers. So essentially oxycodone or fentanyl, because it was that severe, or a hysterectomy.
And how did you feel about those options?
I was a little shocked, to be honest. I was like, how is it 2025? And my option is drugs or losing an organ. I was absolutely like flabbergasted, to be honest. And when I took that news, I actually went to probably 4 or 5 separate gynecologists and saw separate surgeons as well. And they all said the same thing. So it wasn't until I actually saw this lady where she said, in my experience, people with endometriosis and adenomyosis do not overemphasize their pain. They don't exaggerate their pain. What they have is very, very real. And it was at that moment I decided, like, okay, there has to be something else out there. And that's when I started to pretty much ask everybody that I know, because like I said, I was in the healthcare profession. And luckily, somebody told me about focus ultrasound.
When did you first learn about that? Do you know what year it was and what the circumstances were when they mentioned focused ultrasound?
Yeah, so it was actually Dr. Fiona Lovely. She has a podcast called Not Your Mother's Menopause. And I believe someone from your organization was on her podcast speaking about uterine fibroids. And Dr. Fiona is one of my best friends. So when I was suffering with this, we just had a phone call and she's like, you know what? I just had this doctor on the podcast and she was talking about focused ultrasound. She's like, I've never heard about it before. Maybe it will help with adenomyosis. I went on your website and just started to Google who does treatment for uterine adenomyosis. And unfortunately, there isn't hardly anybody in North America. I believe it's only the Mayo Clinic and Stanford, I believe, are the only 2 places there. But in China and also in Asia in general, the treatment for adenomyosis is very popular. So I was looking at several different countries. One was Japan, South Korea, Malaysia, and then also China. And then I was like, well, why not go to HIFU, which is where some of the technology really started. So that's where I found out about Chongqing. And as preparation to go, I had to get my Chinese visa and make sure my passport was updated. And but then I just took all of my medical reports, my MRI, all the imaging reports that I could get my hands on. And then I managed to get in contact with their patient liaison, and they took great care of me.
Can you talk more about how they walked you through the potential treatment and helped you, get acclimated?
Yeah, everybody was so incredibly sweet at the hospital. So they actually picked me up from the airport. And then we went for lunch, and then they dropped me off at my hotel. And I had 2 days to just explore Chongqing by myself, which is an amazing city of 36 million people. It's almost the entire population of Canada in one city. And so I got to explore the city. And then from there on Monday morning, they picked me up and took me to the hospital. So the hospital is a smaller offshoot of the big Chongqing General Hospital that they have, but it's the HIFU hospital. And the only thing they do there is high intensity focus ultrasound. And so I think it's 32 beds in the hospital. And it's just this beautiful little place. Everybody is so friendly. All the doctors spoke English. Maybe half of the nurses did, but we all had translation apps. So there was no confusion or anything like that. Some of the translation sometimes was pretty funny, but overall, we did just fine. And yeah, so I got checked into the hospital. And then on the Monday, they did all the initial exams, height, weight, blood tests. They did another MRI, and then the Tuesday I had the procedure.
Yeah. What was the procedure like?
It was very interesting. I was kind of prepared, but at the same time, I really didn't know what I was getting myself into. You lay on your stomach for my treatment anyways, and then the ultrasound is underneath you. And they did sedate me because apparently I move a lot. So they usually I was awake, but I was quite sedated because I had a very itchy nose. So I was trying to scratch my nose and they kept telling me not to move. So they did sedate me probably a little bit more. But I just remember the treatment took 3 hours. And I had a nurse right by my head the whole time. And they would give me, because you get very dehydrated during the treatment. So then she would just give me almost like ice cubes to kind of just suck on, I guess, to keep my mouth moist. Honestly, the experience that I had couldn't have gone better. Everybody was so kind and just so like concerned for my well-being. And like I've said before, they really just took care of myself, the patient. I didn't just feel like I was a disease with a body. They really just actually took care of me, which was amazing.
Did you experience any pain or any side effects?
So during the actual treatment, I would say that there was a couple times I felt pressure where I could feel like, just pressure inside the uterus and kind of towards the back of to my spine. But there was no pain. It was just like a pressure feeling. And then after the treatment, I was awake, I was talking, and then they took me back to the room and I fell asleep for 3 hours and then woke up, went to the washroom. They put a catheter in because it was a 3-hour procedure so they can control my bladder. And then, so they took the catheter out. I had no pain at all. And then 3 hours later, I woke up and it was about 7 or 8 p.m. and I felt amazing. It was one of those things where I woke up and I was like, wait, why do I feel so good? I had no pain. I had no discomfort. I felt like a completely different person.
That's amazing. And so glad to hear that you were pain-free finally.
Yeah. And the next day, it was quite funny. Dr. Ma, one of the doctors, she comes in and she's like, "Good morning, Vanda. How are you?" And I said, "I am 100% so elated and happy and I'm pain-free." And I just, honestly, I couldn't believe it. Cause like I said, I had that pressure pain that had always been in my uterus, always. And it was gone. Like I had zero discomfort at all. And I'm like, I'm 100% elated. And she's like, but what? And I was like, but I'm also 100% incredibly angry. And she's like, why, what? And she thought I meant like I was angry at the hospital. And I was like, no. I'm not angry at you. I am angry that nobody knows about this. Like, why is this almost like a secret, right? I'm like, why is this not like people screaming from the rooftops? So that's why I was so excited to do your guys' podcast, because I've decided that one of my life's mission is to get the word out about adenomyosis, about the treatment, and that there is possible help for it out there, because I'm just like so frustrated that this is not in every hospital in North America. Why is this not a treatment?
Well, and speaking of getting the word out, you decided to film your experience traveling to Chongqing for treatment, your experience during and after the treatment. What made you want to share your health journey with others?
Just for the exact reason I just said, like more people need to know about this. And I mean, of course, the way we find out anything nowadays is through social media or YouTube and type it in. So I was like, how can I reach the most amount of people the easiest way? And so I was just like, that's it. I'm going to film the whole experience and make a vlog out of it. And then hopefully people will be able to find it.
Have you had anyone reach out to you or send you a message or write a comment on your YouTube videos?
I have actually several, including several people have commented on my YouTube videos. And then not only that, they actually found me and sent me emails. So I've had people reach out from France. I've had people reach out from Germany. Also, just even on my Facebook, when I shared it, I had 3 other friends who, I did not know this, but they've actually had hysterectomies because they had adenomyosis, but there was no other option for them. So it's just like, it's for them, unfortunately, it's a little bit too little, too late. But I mean, I'm just trying to get the word out there that there is other options besides just losing an organ.
Right. And especially for women who want to preserve their fertility too, this is a great option for them instead of hysterectomy.
Oh, 100%. I mean, it's really hard to have a baby if you don't have a uterus, right? But it's interesting at the hospital, at the Haifu Hospital in Chongqing, they have, when you walk in, they have this incredible wall that's they call it the conception wall. And it kind of takes you through the story of from like very beginning conception to the end to the baby. And then they also have another thing where they have the Haifu babies of the world, where they have a picture of all the kids who have been born after the mother has obviously gone through treatment for adenomyosis in the hospital. So, and they have hundreds of babies who have been born after treatment.
That's incredible.
Yeah.
It's been months since your treatment. How are you doing now?
I am doing so well. So I had the treatment in May. So I guess that's 4 months ago, almost 5 months. I am doing really, really well. So I would say that my pain now, I still have a little bit of cramping, but I would say it would be, it's not normal, but like a little bit of normal cramping about 8 hours before I start my period. And that's it. So yeah. So I've gone from 8 days of debilitating pain to 8 hours of like, my period must be starting tomorrow. So it's an incredible, incredible difference. And the amount of bleeding as well is significantly decreased.
What would you say to others who are considering focus ultrasound for their adenomyosis?
If they are a candidate for it, just do it. You can always, have other treatments or a hysterectomy later if it's more severe. But honestly, it was one of the best decisions that I've ever made in my life was to just get on a plane and fly to China. Even if I got a 50% decrease in my symptoms, it would absolutely be worth it to me. But I think I've probably gotten an 80 or 90% decrease in my symptoms. So it's just it's absolutely worth it. And I encourage anybody, if they do fit the criteria to have HIFU, to go for it, because it could actually change your life as well.
And how can listeners keep up with you or check out your video of your experience traveling to Chongqing HIFU Hospital for treatment?
I have a YouTube channel. It's called Just Vanda, Just, Vanda, Vanda. And I'm pretty easy to find on YouTube. And then also my Instagram is just dr.vanda, Dr. Vanda.
Well, thank you so much, Dr. Vanda Corbett. It has been so great to hear about your experience. We're so happy to hear that you are now pain-free and that the foundation helped you find out about focus ultrasound treatment.
I thank you guys so much, because honestly, without your database of being able to search where I could go, I don't know what I would be doing today. So thank you.
This episode of Curing with Sound has been presented by the Focus Ultrasound Foundation. If you'd like to learn more about Focus Ultrasound or the foundation, visit our website at fussfoundation.org. You can also sign up for our newsletter and follow us on social media. Be sure to subscribe to the Curing with Sound podcast so you don't miss the latest information about Focus Ultrasound. You can also rate and review the show.